My name is Edwin Odoyo. I work with the International Cancer Institute as a program manager for the BluePrint for Innovative Access to Healthcare program. The BluePrint for Innovative Access to Healthcare program is an access to NCDs care program, including cancer, through multiple implementing partners who are working together for a common goal throughout the patient's journey, from targeted health education, early screening, early diagnosis, early optimal and appropriate treatment to palliative care, survivorship and research in low and middle income countries. So this program began in 2019, early 2019, and so far we have been able to roll this out in 2 main counties within Kenya, that is Meru, and currently now the same program is being rolled out in Makueni County, based on the previous successes and gains that we have seen from the program during its implementation in Meru County. So I'd like to just take this opportunity to also recognize the fact that under the leadership of Professor Chite, who is also the Executive Director of International Cancer Institute and also the overall program Director, and also the principal investigator for the program, for the BluePrint program, we have had a very robust program so far in the 2 counties, but I would like to also just dwell so much on Makueni County. So with Makueni County, we had initial conversations back and forth from the county leadership, led by the county governor, Professor Kivuta Kibwana, and also Professor Chite. And through this back and forth, they are able to approach International Cancer Institute to be able to roll out a similar program based on the successes that they've had from the other counties.
Now, for the oncology clinic, which started with a small number and has grown with time, right now we see cumulatively over 100 patients. My main job there is basically the chemotherapy area, whereby we give chemo to these patients. Initially we started doing it 1 day every 3 weeks, but with numbers which have been swelling and the increasing demand for the services, we have been able to scale up our services. We usually give chemo every Thursday and Friday of the 3rd week of the month, which we hope to grow with time.
I've been working with a cancer patient for the last 3 years, and what we do with them is that we do nutrition anthropometrics, where if a patient is underweight, we give supplements, and if a patient needs to lose weight, we also counsel them if they're obese or they're overweight. The other thing we do is that we do nutrition counseling for the patient so that they can be able to improve their status when it comes to nutrition.
It's actually been a very successful program so far, and we hope to continue partnering with the county government of Makueni and any other county out there that is ready to roll out a similar program. We are able to engage with our program director and also be able to see how to help out in those other counties. The most important thing about this program is that we are taking oncology care services, which, as you are aware, for a very long time has only been accessible at the hospitals within Nairobi, that is the National Referral Hospital, which is Kenyatta National Hospital, and also the private hospitals, Aga Khan, MP Shah, and the rest, which, as you all are aware, the services are quite expensive and out of reach to the common mwananchi. So rolling out a similar program in a county referral hospital makes it possible for these patients to be able to access these services near to their home facility, and therefore also cut out the other logistical issues in terms of traveling and accommodation when they seek these services. So I'd really like to thank all the partners who've been involved in this, International Cancer Institute and also Makueni County, for rolling out this.
Thank the International Cancer Institute for the offers that they've given us through Makueni County government, where they've given the support they've done to the hospital. And also, I thank the doctors who are connected with this International Cancer Institute, because they are giving us very good assistance. And I also request whoever has gotten that assistance to thank, and on that behalf, I thank that International Institute, Cancer Institute, and Makueni County government.